Hey guys, it's Nikki. In honor of May being Mental Health Awareness Month, I wanted to make sure that I publish this video in regards to mental health. And of course, we're going to talk about von Willebrand disease. But I also want to mention that even though we're talking about von Willebrand disease, this can just go towards anyone living with a bleeding disorder, period. I decided to do this outside. I decided to be in some sort of I don't know, like just a scenery that would kind of just make me calm to talk about this because there's a lot of things we're going to kind of touch base off of. So, as you all know, I do have von Willebrand disease, type 1 severe. So, I was diagnosed at 16. I had my period. It looked like I had a kid. And I was so scared, so nervous. And I didn't really know what that meant for me. I had terrible nosebleeds my whole life, terrible periods, and I didn't think it would be any different. I'm like, what am I gonna do? So then infusions were brought to my attention when things were just becoming out of hand, and I was okay with it. But I was also in school. It was affecting my life. It was affecting my education, so it took a toll on me. Um, I was forced to come back to New York for school because I couldn't be away from the hospital that I was getting treatment from because it just got that bad. And since then, that's been history. So I was still able to finish school at the grain of my teeth. So that's just how that beginning stage happened. It wasn't until I was like 20, 21. I want to say is when things really like hit the fan. I would say. um, it was brought to my attention that I was supposed to make a decision of having a child or having a hysterectomy. And at the time, my spouse and I, we were in a situation where it was like, what are we gonna do? Like I was 21, he had to be like 23. He didn't want a baby at the time, and I didn't think I needed one either. Um, and for a while, I was reaching out to so many people. Like, is this true? Is this where I'm at? Is this what everything is gonna just fall into? And of course, that's around the time I met the New York City Hemophilia chapter, and I was able to reach out to the females there. I would be at the sessions with them, and I would start crying. My god sister was like so upset about this situation too, and she just wanted answers, and we all wanted answers. And I just, as much as I wanted a child, I was like, I didn't want this right there and then. I had seen like several GYN doctors, several hematologists, and it just all went down to that. This is before my HTC days, so of course I'm in Suffolk County and no one knows what they're talking about, but whatever. It took a toll on my relationship for a long time, and I can't be mad at that. I was mad at them. I was mad at them giving me those two decisions. So what could I say? What could I do? Over time, after seeing other doctors and finally getting to an HCC, I finally found out that that necessarily isn't true. I didn't really have to have a child. I mean, some women with von Willebrand disease, they were presented with the option of having a hysterectomy really early because of certain situations. Um, it has been brought to my attention as well, but no provider was ready to do that. They thought I was healthy enough to still at least have a child because it was only fair. But again, still not there. But it is what it is. Um, it was about 2 years ago that something was introduced to me that changed my life forever. And over time, I started to notice I was infusing like crazy. And at this point, I'm in the hospitals, doctors, nurses, IV teams, everyone's coming in trying to get IV lines in me, and they're so unsuccessful. And we're not getting anywhere. And it's frustrating because now I'm looking like a heroin addict. So, I wear scrubs to work. I wear, they're short sleeves. So obviously, when you're looking at my arms, they look crazy. I had went to my first NHF conference, and that's when it was brought to my attention that a port was a possibility. I didn't think it would be for someone like me, but I was saying, you know what, I really have tough veins. Like something's got to give. So I brought it to my hematologist's attention. He said, sure, why not? We did it, and I had my first port. I'm sorry, no, this is my second one. My first part was here. You can't see it, but it was here. And it was there for 7 days before it had to be emergently removed because I had a serious infection. Um, it went wrong in so many different directions, but I didn't stop there. I was like, oh my God, this is like the best thing ever, because I was still able to at least infuse like once or twice through it before I got rid of it. So I got another one, and that lasted for a long time, and I was so happy with that. But of course, then it landed to a very serious infection. And I want to say that this infection, I think this is when I hit I hit rock bottom, because I don't know if I didn't come to terms that my blood disorder was something that was putting me in a mental space that wasn't in just right. Um, but my infection that I got, it was a pretty serious one. It was a really serious. One was just a skin, and then the second one is it's an infection that you get in the hospital that's pretty much impossible to ever get rid of. Really, really tough. It's resistant to so many antibiotics. So, and this was also around the time in November when I almost died. So, it's tough, because when I talk about this part of the situation, I don't really know who or what went wrong. I don't know if it was the port. I don't know if it was the infection. I don't know if it was the medication. I don't know. But if you guys know, if you saw that video, when I had administered Humate P and then I had seizures and everything like that, I don't know where anyone went wrong. I really don't know. But I know that I almost didn't make it. And I'm thankful that I'm here this day. I'm thankful that I made it to my 27th birthday. Um, but ever since November, losing the port, going through so many things with the infection, it was tough. It was so tough. And I think ever since November, I haven't fully recovered. I've been in such a bad mental space since November. And I I don't know, like sometimes I'm like, why am I still here? Sometimes I do hit those rock bottoms with the blood disorder, because when this all happened in November, I was also in transition of having new doctors, new teams. So I had to go through several people until I finally got comfortable with someone. And now I am comfortable with someone, but that took a while. I had met a provider, and she kind of made me feel like my blood disorder wasn't serious. She made it seem as if my blood disorder was something that was just because I'm a specific type of blood type. So I was just kind of binded into this blood disorder. So it's not that serious. She was forcing birth control on me, even though I didn't want it. Um, I hit a place where I was just like, what is going on? It was just so many things. And she wanted me to have birth control when I didn't do it on her terms. Her staff and herself disrespected me so many times. They said that I didn't know what my periods were supposed to look like, that I was minding it to what I saw when I was 16 years old, that it's not like that all the time, and that um, they wanted me to take pictures of my personal things down there so that they could see what was actually coming out, because they were like, listen, whatever you're saying is coming out is not really kind of adding up. And I was just like, I was livid. I was so livid, so livid, and I didn't know what to say. Um, But I told myself I couldn't give up, and I told myself I had to find somebody else. There was going to be somebody out there that was going to be able to take care of me. And I did, and I finally found someone, and I'm really happy. But I think I let what happened in November, and I let what happened with the ports, all of that kind of just overshadow me. And I've just been in a bad place ever since then. So, what I think is important about this video is that the difference between myself and probably others who are living with a mental disease or are going through things is that I had never trials and tribulations. I've had personal family problems where I've had anxiety attacks. Sure, who hasn't? But at this point in time, since November, I've been in a place where I've been uncomfortable, and I've been questioning myself. I've been so depressed. And to be honest, this is probably the first time I've ever admitted it. I've never been so depressed in my life until most recently. And since November, I mean, obviously, since November up to the beginning of the year, there was a lot of transition. So I didn't have enough time to like admit to myself that I was depressed. But I was really depressed. I've been really depressed. You guys don't understand that living with a bleeding disorder, and for those who are living with it, you'll understand. There's so much that goes involved. I've missed work, I've missed school. I don't hang out with anyone. People don't want to hang out with me. People don't feel comfortable hanging out with me. Sorry, Bella wants to get in the video. People don't want to hang out with me. Um, no one wants to be in my life as much as I used to have people in my life compared to now, because obviously things are worse. Um, and then on top of all of that, I live with this in my chest. I chose this, and I'm not mad about it. I'm happy with my central line. I'm resting, next to the port. Um, but you guys can only imagine how I feel when I go out, and I have to always have something like this so that nobody can see. Always wear something like this, like always something. And sometimes it's kind of hot. I want to wear a tank top. um, I don't go to the clubs. I don't really drink. If I have a drink, it's like one or two, and it's like the babyest baby drink, the Malibu Bay Breezes. I don't do a lot of things. And you would think like, oh, type threes and type twos, they go through stuff way more than type ones. So you would think that I would be living like that. Now, don't get me wrong. I have been told that I'm possibly, definitely a type two. So maybe that's why. But like the things that I go through, I think that has pushed a lot of people away from wanting to be my friend or be in my life. And I think that some people might find it embarrassing. So those feelings that are not necessarily verbalized, their actions show it. So it puts, I may not say it out loud, but like people just don't know like how much it hurts me to know that somebody may not want to converse with me or be my friend or hang out with me because they know I either have this and it's embarrassing, or the fact that I just have a bleeding disorder in general. I was even told one time that someone told me that I talk about my blood disorder too much, and that might be pushing people away. And I was like, I don't care. Like if I'm out in a setting, I'm not talking about it. But if somebody's gonna ask me what's this and what's it for, what's your tattoo mean, certain things like that, I'll talk about it for a moment. But like my conversations with people throughout the day was 24 hours in a day. We're up for maybe 12 to 18. I might talk about Von Willer Brand for an hour, and that's it. If people ask me questions, I answer. Um, Work is tough because sometimes people at work look at me like, oh, here she goes, something else. Like that's as much as people may not be saying that or deny it. I know it's happening. Some people roll their eyes. Some people, I see it. I see it all. It's frustrating and it's hard because I know it will never stop. I know that my disorder will never stop. I know that I will never ever stop having these complications. So I know that my depression will always kind of linger. I've been told I should see a psychiatrist. I have done so. I'm not really too comfortable with it because on a normal day, I'm fine. It's just that when I am going through the things that I'm going through, I know that it's going to put me in a bad place. So it's kind of tough. I do have other personal life stuff going on, but like that's whatever. I've been thinking about things that probably can help me get better, and it's like I'm thinking like writing in a journal, listening to music, um, I don't know, taking a walk, a jog, things like that. Um, I've been thinking about it most recently because, like I said, I haven't really deemed myself to be depressed up until only most recently. So, if I'm honest with myself, I would tell you guys right now, if you're watching this video, right now, I'm severely depressed, and you guys don't even know it because I'm doing so well, probably having a good poker face. Maybe not all the time, but I really do have a great poker face. There were times where I thought to myself, like, why am I even here? I know I have a purpose, but it's like sometimes I'm just done. And like I said, this is all recently. Before I wasn't like this. But now I don't know. I just feel like I get treated differently by a lot of people now. A lot of people that I love, a lot of people that have had friendships with. Everything's just so different. Everything's so different. Everything's so different. And it sucks. Um, but I wanted to not just make this video about me, but I wanted to just shed light on how a person like me is living. Like we're bleeding disorder patients and we go through so many things and so many embarrassing moments for the women. And I'm not saying men can't get embarrassed. I'm just saying for the women, when we have that time of the month, it's embarrassing with what we have to deal with and do. And I think that it's important for our supporters to just be mindful of stuff like that. Just understand that a hug, a simply, how are you doing today, and genuinely mean it, a simple text, a simple call, a simple anything just can just brighten our day. Like half the time I'm just kind of feeling fatigued because I know that I'm feeling fatigued because I don't have all the blood that I should have. Um, Sometimes I'm just not speaking up, and sometimes it would feel good for someone to notice that. Um, I don't have my god sister with me all the time. I don't have my baby sister with me all the time. So those things that make me happy, I can't have access to all the time. So when I'm alone, I feel alone. I feel really alone. So I don't know. I mean, I don't want you guys to take this video and be completely concerned. I just want you to understand that I'm just learning myself, my mental health awareness. Um, and for my bleeding disorder patients, I think that you should all take time to reflect on yourself and see how you really feel, because I didn't do that until most recently, and I regret not doing that because I feel like it would have been better maybe earlier. But I do also know that there was some time that needed to be taken for me to understand that I was depressed and maybe not be afraid to admit it. And I may not be depressed forever, but I know I'll get over it. It just sucks to know that the people that I want in my life the most are gone and may never come back. Also, it just sucks to just be alone. And I don't mean like I don't have anybody. That's not true. It just it sucks to know that I'm living with this blood disorder and having to fight all the time. I feel like I'm fighting by myself, and I'm not. I'm not. I just feel like when it's me against my body always wins. But then when I start to take care of myself, I'm like, I'm winning, I'm winning. So it's always like a battle within myself. And it's hard to explain to the people around me because I don't want them to feel like I'm neglecting them and saying, oh, they're not here for me. That's not true. It's just, it's just hard to explain. Like, you're not, I'm looking at this person, like, you're not bleeding. I can you imagine? You can go outside with a tank top and not look that. You can drink. You can get on roller coasters. I can't do any of that. At least not without medication. I mean, and I hate that. Like, no one should be like, oh, I can't do this because of this. I don't want my patients to feel like they can't do things because of a certain diagnosis. But there is a threshold, there is a barrier, everything's present, and it just becomes a situation where we need to be mindful of that. So I would just say, if you're watching this video, take a moment, ask your friend how she's doing, not me, but ask your friend how she's doing, what he's doing. Tell somebody you miss them. Tell somebody the truth about how you feel about them, because we all know life is too short and we don't know what the next person is going through next to us. People wear poker faces. I mean, I just said it. I do it all day, every day. I'm at work and people think I might be happy and I'm suffering inside. I'm suffering so bad. And sometimes I just stay quiet because I'm like, these people do not care. Because they don't. Let's be honest, they don't. But if someone does genuinely care about you, that is an amazing feeling. The person living with a bleeding disorder, it may not just be a bleeding disorder, it could be anything. The person that's living with a situation, be mindful. Yeah, we all go through things, but just be mindful to each other. Like, I'm more than happy to talk to the next person about how their day is going, what's going on. Um, I would hate to lose somebody to something because they felt like they couldn't talk. So, I mean, I'm gonna try some exercises. I'm going to try to get my mental health back together. Um, but I wanted to make sure that I did a video for Mental Health Awareness Month for May because I think it's important. And I think that if I'm going to advocate for living with a bleeding disorder, I think it's fair that I be brutally honest about exactly what's going on in the heads of a bleeding disorder patient, at least myself. It's always nice to talk to you guys, and please always feel free to send me any questions, comments, or concerns.